Welcome back. I'm your host, Dr. Noah, 21st Century Natural Health, and a review of the scientific literature of the last week. As has been continuing for the last 4 weeks, we have a flu update, some of the headlines on the internet and through the different media throughout the world. We have Manhattan school closes as swine flu unease spreads, Japanese acts to contain flu, Japanese may trigger a pandemic, swine flu shuts down 16 New York City schools. Now, swine flu is a particular type of disease that's out there, part of the flu. What was interesting last week that was came up and then kind of disappeared. There was an Australian researcher, Adrian Gibbs, who's a PhD, who was actually a co-developer of Tamiflu, the drug that we've talked about in the past, that costs about $300, and it reduces the signs and symptoms by 1 day. That's right, instead of 7-8 days, it reduces by 1 day. Billions of dollars being spent on something like that. Was kind of interesting. He thought the swine flu was actually creation in the lab, possibly some processing with the eggs with the vaccine. So that was kind of interesting to note. Now, during Monday, it's been over 4 weeks. There's the World Health Organization has stated that there's been 8,827 people that have been confirmed. Once again, people get sick with flu, the seasonal flu, and colds and stuff. That's not the swine flu. Remember, there's over 6 billion people. 76 deaths. That's no fun, but as I'll show you here, it's a small number compared to what happens due to medical procedures and drugs. So it's about 2.5 deaths per day for the last 4 weeks. The CDC also stated Monday that about 100,000 people were probably infected. So during those 4 weeks, what's happened is that the same number of deaths due to adverse drug reactions. This is all, once again, peer review. We've discussed on previous of these updates on my TV show. Medical errors, bed sores, infections, unnecessary medical procedures that cause death, and surgery always has death. During that same time, when 76 people in the world died, 64,920 deaths occurred in the same amount because of those medical procedures. And keep in mind that also about 5 years ago cost $93 billion per year. So just a little tidbit of getting a perspective of the virus versus other type of things that cause harm and death. In this Lipids May 2009 article about coconut oil has some controversy being sort of a saturated fat. This randomized control studies from Brazil showed that it actually helped increase HDL, the good cholesterol, and decrease the LDL. And so that was a very, very interesting study on that. Probiotics, which we've talked about many times, it's the good bacteria that we should have in our colon, but due to antibiotics and poor diet, that decreases, and actually it's reversed. In this study showing that probiotics protect infants against eczema. This was a Netherlands study, randomized control study, 3 months from the ages of 1 to 2 years old, showing 100% better control of eczema with just probiotics, and that was in the medical journal Allergy, May 2009. Omega-3 fatty acids, the fish oils in children with ADHD, the attention deficit hyperactivity disorder, Canadian study, randomized control study, gold standard, 16 weeks, showed that with just the fats alone improved the symptoms of these children with ADHD, and that was published in Pediatrics Child's Health, May 2009. Mediterranean diet, which we talk about, it's kind of a basic type of plan, but other ethnic foods have also been shown to be very effective. But the Mediterranean diet in this study in American Journal of Epidemiology in May 2009 showed that it was able to lower blood pressure. This contributes, as a quotation from the doctors who did this study, contributes to the prevention of age-related changes in blood pressure. And being a specialist in management of aging, trying to make yourself feel and look better, that's important. That's what I use as one of the many aspects of good management of age. Vitamin D and vascular calcification and chronic kidney disease are a very, very devastating type of disease, chronic kidney disease. One of the problems is calcification, which continues to cause the kidneys to fail. In this French study, they were able to show that 42% improvement in terms of chronic kidney disease with those on vitamin D deficiency. And we've talked about before, most people are vitamin D deficient. So Clinical Journal of American Society of Nephrology, May 2009, you can read that. Fruits and vegetables reduce risk of colon and rectal cancer. Number 2 killer after smoking. Netherlands studies, big study, 452,755 subjects over an 8.8 years, showed an 86% reduction in the highest quintiles, which means that people that had the most fruits and vegetables were able to reduce colon and rectal cancer by 86%. And you can have that or have your drug doctor read that at the American Journal of Clinical Nutrition, May 2009. Low folate, which is B vitamin, and B12 associated with depression. Spanish study, good size study, 9,670 subjects, showed that there was a 300% increase in depression if these patients were, or subjects were, low in folate and B12. High intake of those particular type of nutrients actually reduced the depression by 42%. Journal of Human Nutrition and Dietetics, May 2009. Another study of vitamin D and blood pressure, University of Wisconsin-Madison, inverse relationship. Once again, vitamin D is a critical nutrient. You should be taking that, taking at least 1,000 to 2,000 international units, depending on your age, your gender, and also your body size. Ginger alleviates nausea and vomiting in pregnant women. Lots of studies showing this, once again, helping with nausea and vomiting. Here, this study in Journal of Alternative Complementary Medicine, May 2009, showed that 250 milligrams per day for 4 days was able to be more effective than placebo in terms of helping with this particular type of problem. Postponing retirement helps delay dementia. King's College London study showing that each year of working was able to decrease the amount of dementia onset by 6 weeks. Journal of Geriatric Psychiatry, May 2009. I've heard about this. Medicare, Medi-Cal, Social Security are all ready to bust. The high cost of drug care isn't working and keeps escalating. Now we're up to $2.5 trillion, and we're the last in the world in terms of health. It's great for getting people on drugs, but it's not in terms of health. In this particular type of release from the government showing that that this will basically be exhausted, meaning there'll be no more money by year 2017. So in 8 years, no more money. This is a nice little type of review, the 10 Commandments in Preventing Cancer by the Melanoma Skin Cancer Detection and Prevention Society, May 2009, which they said 1 in 3 will develop cancer, 1.437 million new cases, and 560,000 deaths per year. We also talked about on my TV show and also on this that next year the World Health Organization and the CDC estimate that cancer will surpass cardiovascular heart disease as the #1 killer. So to help reduce cancer, avoid unnecessary exposure to radiation. That's X-rays, CTs, exposure like that, flying too much, other types of radiation. We talked about microwave increasing an acoustic type of carcinoma in the brain because of cell phones by 240%. We've also talked about the third leading cancer research institute in the world at the University of Pittsburgh, claiming that there's a new study coming out, and the head researcher actually warned over 3,000 people in the complex there to stop using the cell phones as much, trying to reduce that. Of course, avoid tobacco products, eat properly, exercise regularly, stay lean, drink 1 to 2 glasses of wine or alcohol. We talked about avoid environmental toxins, avoid infections, low dose aspirin, and vitamin D. Very simple things, things that you can start doing now. Also in the same type of publication showing that the 10 things that you do to prevent heart attacks, and this was interesting, drinking 5 glasses of water per day is able to reduce the fatal heart attacks by 54%. Now keep in mind that statin at its best reduces death by 34 to 37%. So drinking water was more effective than statin drugs, a $37 billion industry, and lots of side effects. Convince your partner to stop smoking. That would help 92% of the time. Exercise 30 minutes per day, 4 times a week. 60% reduction in heart attacks. Lose 10 to 20 pounds. That gives you an 8.2 extension before you have a heart attack. Switch coffee to tea. 2 cups of tea per day was able to reduce heart attacks by 50%. Eat fish twice a week. Harvard study showed a 30% reduction. Vitamin E and aspirin was able to show 80% cut and plaque, University of Pennsylvania. 1 cup of corn flakes, which just happens to have folate to B vitamin, is able to reduce heart attacks by 13%. Reduce stress and anger. Anger increases heart attacks for before age 55 by 300 to 500.